1, 2, 3, begin.
Good evening, Professor Fuller. Good evening, fellow colleagues. Tonight we'll be explaining an ACL tear. An ACL tear occurs when you're basically doing sports. You can get it when you're walking, slip and fall, coming down the steps. It can occur anytime. This injury is very, very excruciating. I myself, as you can see here in the photo, underwent surgery back in June of this year. June 13th, exactly, the exact date. ACL is basically a ligament in your kneecap. See, for instance, this was your tibia and your fibula. This is your ACL. Your ACL holds your knees together. And if that comes apart, it's a lot of pain. This pain is very, very, very excruciating. Some people have to undergo surgery, some people don't. For me, I underwent surgery for a lot of reasons. One is running. I like to run sometimes. I like to work out. Here, basically the reconstruction of the surgery. As you can see here, somebody has their knees bent. If you feel like right under your kneecap, you'll feel a piece of ligament right there. They'll take that ligament out. They'll pull it out like a string before, and they'll screw it from your fibula back up to the tibia and bring it straight across with the screws inside. The healing process for this is about, I'll say 6 months. 6 months, you have to be on bed rest for 3 straight weeks after the hospital. You can't get out, you can't do nothing. So basically you're paralyzed for 3 weeks. This is when family comes into play. You have to get family when it comes into play. And your leg, it's amazing me so fast how fast you can lose muscle tissue and everything in just a matter of a couple of weeks. You won't notice it until something like this happens. When I noticed that one leg was bigger than the other, you have to learn how to walk again, how to bend your knees. You know, it's a lot of extensive therapy you have to go through. And if you don't go through this, some people might have to get surgery again just because there wasn't moving and various reasons. Back to my experience with this. My experience is, I was playing basketball when this occurred. I tore my ACL and my meniscus, both at the same time. I didn't know this, but once something like that happens, you'll know it's a problem because you'll hear it. You'll hear it and you'll feel it at the same time. So when this happened, I know it wasn't nothing good about it because it never happened to me before. You try to walk it off and you try many things, but it won't happen. Your knees will just give out and you just be laying there for a long period of time. And the surgery that I had was about 3 hours. They won't keep you that long. You go in and right out. Right home, me personally, I forgot to take the Vicodin painkillers. A lot of nurses in the building, you know, seem to be, but Vicodin is a very, very strong drug, and I forgot to take my Vicodin right after my surgery. This was the worst pain I ever experienced in my entire life. I'm an electrician, I ride motorcycles, I've been in a couple accidents here and there, but this of all, this took the cake. You know, I shed a little tear, I'm not gonna lie. Shed a tear, it was hurting. You understand? But the ACL, as you can see here, is torn. You can also tear your meniscus at the side. Meniscus is basically the cushion between your knees. That's what keeps you to bend and run, so you don't really feel anything. If meniscus or none of that wasn't there, this is what you would have. A whole bunch of this going on. And we don't want that. You want to be able to run and move around, up and down. And for the rehabilitation, some say it takes 6 months, but you're not fully healed until about a good year, and your legs still won't never be the same again. Now until this day, I'm standing here. I may look normal walking. I'm not. Make it look good, you know. Make it look good. But yes, the ACL, to prevent this kind of surgeries, you have to do a lot of stretching, a lot of exercising, you know, running, and just trying to keep staying active. And be very, very careful of what you're doing at whatever point in time. If you see a little bit of water, don't go here, go around it. If you're playing too much basketball excessive, calm down. Because this, trust me, my fellow colleagues, you do not want this feeling at all. Period. So the first form of, I'll say, the rehabilitation is bending your knees. That's the first. You have to get a walker. You have to learn how to walk all over again with a walker. And bending your knees is the first. And that's the hardest part, hands down. I would just like to thank the class for listening to me, Professor Fuller. Good night, fellow colleagues.